Hi all, welcome back to my channel. Again, I am back with one more interesting topic, that is ANTT. I really don't know how many of you have heard about ANTT, and it plays a very important role in preventing infections. So let's see that in detail. ANTT is aseptic non-touch technique. As you all know that aseptic technique is a sterile technique used in all the clinical procedures to prevent infection. So what do you mean by aseptic non-touch technique? So here mainly we are identifying the key parts and key sites, and without touching them we are maintaining a aseptic technique that is known as aseptic non-touch technique. So first of all we should know what is key parts and key sites. Let's see that in detail. Let's talk about key parts first. In our day-to-day activities, all the equipments which we are using has its own key parts. If we touch the key parts directly or if we contaminate, it will end up in causing infection. Let's see some examples. This is the syringe that we are using daily, and the area which is spotted as red is the key part here, the tip of the syringe. Here is the needle. Here you can clearly see which is the key part. That is the hub and the bevel of the needle, which is spotted as red. Here you can see the key part in leer lock and safe side, which is spotted as red. These are all the key parts in three-way stopcock, which is spotted as red. These are all the key parts in 10 centimeter extension, as you can clearly see in the picture. These are all the key parts in the IV cannula, again the tip of the needle as well as the area where we connect the extension. This is an IV set, again here the spike and the leer connector is the key part. In Foley's catheter, again the tip of the catheter and the urine drainage port is the key part, as spotted as red in the picture. In central venous catheter, again the tip of the catheter, the exit part as well as the tip of three lumens are the key parts. Again in vials and ampules, in vial the middle part of the rubber stopper is the key part, and in the ampule the neck of the ampule is the key part. So I hope you guys now got an idea about the key parts. Let's move on to the key site. Key sites are open wounds and insertion or puncture sites for invasive medical devices. For instance, you are going to insert an IV cannula. The site where you are going to puncture or insert is known as key site. In case of wound dressing, the open wound will be considered as key site. So these are all the areas we need to disinfect each time before doing any procedures in order to prevent infection. So I hope now you got a clear picture about the key parts as well as the key sites. So these are all the areas we should avoid touching directly in order to prevent infection. Let's talk about the principles of aseptic non-touch technique. A stands for always decontaminate hands. Here comes our hand hygiene. Before doing any procedures, we must perform hand hygiene. N stands for never contaminate key parts and site, and T stands for touch non-key parts with confidence. So always we should identify the key parts and key sites and avoid touching or contaminate that parts. And the last one is take appropriate infection prevention and control precautions. For instance, usage of proper PPEs, hand hygiene, and so on. Thank you all. I hope this presentation would be helpful for you guys. I want you all to implement this in your practical aspect in order to prevent infection. See you soon with other interesting topic. Until then, it's bye from Jebin. Take care.